thank you so much for joining us today. This is the second town hall we are holding, and our first one was held on April 24th, and it was very well attended, and I understand today we have, I think, over 350 participants joining us. So thank you for being here on a, well, depending where you are in the province, a sunny Friday afternoon. And you're here with the other half of our Provincial Nursing and Allied Health Council. So last time, if you were able to join us, you would have met some of the other members of the council. And today you've got some new faces, and we will do some introductions around that. So the first session really kind of focused on sort of things that were being experienced during the pandemic, and sort of in the midst of that, certainly things around managing uncertainty, questions around personal well-being and resiliency, as well as safety, and topics around professionalism and what to do in certain circumstances. And today, although we're still in the midst of a pandemic, we are kind of moving into that next phase, phase two. So today is really about kind of reflecting on our collective response to the pandemic so far, as well as kind of capturing some of those early lessons learned. And so it's really an opportunity to hear and see our panelists today to share some of their insights around that. So what I will do is maybe turn it over to Lorraine, who has agreed to do our territorial acknowledgement for today.
Thank you very much. Can I just check if you can hear me?
I can hear you, Lorraine.
Okay, great. So it's so exciting to see so many different faces today. So I would like to start to acknowledge that I am joining you today from the shared traditional and unceded territories of the Coast Salish peoples, the Musqueam, the Squamish, and the Tsleil-Waututh nations. And for that, I am truly grateful. And I would ask all of you to pause and take a moment in your hearts and your minds to please recognize the unceded territories that you are joining from today. And we collectively give thanks for being here today and conducting this meeting upon these lands. I look forward to this opportunity for this conversation, and I look forward to hearing from you as well and from my colleagues. So thank you very much.
Thank you very much, Lorraine. And now I would like to turn it over to Michael Sandler, and Michael's the Executive Director in the Nurse and Nurse Practitioners of BC, and he's going to do a bit of a welcome and introduction for today.
Thank you, Joanne. I appreciate the opportunity to collaborate with the CNO Council. So NNPBC, or the Nurse and Nurse Practitioners Association of British Columbia, would like to thank formally Interior Health, Providence Healthcare, Provincial Health Services, Northern Health, Vancouver Coastal, Island Health, Fraser Health, First Nations Health Authority, and of course the Ministry of Health for taking the opportunity to collaborate on this webinar and to provide some information. And we appreciate the opportunity to work with all of you to help nurses across the province get a better understanding of some of the issues related to the pandemic that we've been facing. So without further ado, Joanne, I will give it back to you to introduce the first speaker, and we will watch and listen and learn with the rest of us. Thank you.
Thank you so much, and Michael, to you and your team, Kim, who's been absolutely amazing in fielding my many questions as we got these town halls set up, and just really appreciate the support and providing the platform for us. I also want to give thanks to our team in the NPS who have worked behind the scenes to help organize this, as well as to a little shout out to Island Health and Angela Wignall, who has also assisted in sort of coordinating these town halls. So much appreciated to everyone. And of course to our panel for being available. We know your schedules are busy, and just appreciate the time you have with us. Before we jump into some of the questions, just a little bit of housekeeping. So I mentioned earlier we were going to be recording the session. In addition to that, we will be sending that link out. So for folks that aren't able to join us today, they will be able to view that session later. As well, this session, I will be your moderator, and I'll introduce myself. I'm Joanne McLaren. I'm the Executive Director in the Nursing Policy Secretariat here in the Ministry of Health, and a member of this council. So I'll be sort of your host and moderating some of the questions that we've got for the panel, and watching our time as we do that. The audience, you will notice that you cannot see each other, so it's just the panel you'll be able to see and each speaker as they are speaking, and your lines will be muted, but as Kim mentioned, there is a chat box. I'll try to be watching that as well, and if time allows, we'll take some of your insights and reflections if you've got any to share as well. So just wanted to let you know those few things before we get started. And I'm going to introduce the panel. I'll mention who was here today, but also who also makes up the panel, the remainder of the panel who are not on screen today with us, but I know a few of them are watching. So maybe you can give a little wave as I introduce you, so folks know who you are. So Natasha Cronin-Bala, she's our Chief Nurse and Professional Practice Officer in the Nursing Policy Secretariat in the Ministry of Health. So Natasha, welcome. Jacqueline Purr. Jacqueline's the Executive Director of Patient Experience and Chief Nursing and Allied Health Officer with Fraser Health. Hi, Jacqueline. And Lorraine Blackburn. She's the VP of Professional Practice and Chief Clinical Information Officer with Vancouver Coastal. Leanne Heppel. She's the Chief Operating Officer of Acute Care and Chief of Professional Practice and Nursing for Providence Health. And then Eboya Augustin, she's the lead in professional practice, and she's here on behalf of Kelly Gunn, who unfortunately was unable to join us. Kelly is holding many hats these days as Vice President of Primary and Community Care and Chief Nurse Executive for Northern Health. So Eboya, welcome, and I hope we get your technical challenges sorted out so you can actively participate today. But thanks for being here anyway. All right, and then in addition to the council members, we also have Dawn Nedzelski, who is Chief Nurse in Island Health, who is unfortunately, it's her very last day today, so I'm not sure if she's with us or not online, but we are thinking of her today. Fiona Carmelli from PHSA, Becky Palmer from First Nations Health Authority, and Becky, I know you're participating. And then Cheryl Whittleton with Interior Health. So that was our panel from our first session. Like I say, hopefully some of them are on as well and listening. All right, so let's jump into the questions, which is why our audience is here to participate and hear the dialogue. And I'll start off with you, Jacqueline, a question around if you can share for the participants what the role, mandate, and priorities of the Provincial Nursing and Allied Health Council are, and how might the Council's priorities or focus be impacted by COVID?
Yeah, no, thanks so much, everybody. So the Provincial Nursing and Allied Health Council was formerly known as the Chief Nursing Officer or the CNO Council. And we thought long and hard and did a name change this past January because we really wanted to reflect the diversity of the professions that are included within the Council's mandate. So it's not just nursing, many of us are supporting our allied health colleagues as well. So we wanted to ensure that that was reflected. The Provincial Nursing and Allied Health Officer, the PNAC, is co-chaired by the Ministry of Health. So Natasha is one of the co-chairs as well as one of the Health Authority CNOs, and we rotate that on a 6-month basis. And our mandate is to provide leadership to the Ministry of Health and our key system health partners to guide and influence strategic direction for nursing and allied health practice in BC. So what we've been working on, we've identified 4 operational priorities that are aligned to the government, including the Nursing Policy Secretariat's Priority Recommendations report that came out 2 years ago, as well as our own health authority priorities. And those 4 strategic pillars are digital strategy, education and transitions in practice, team-based care, and of course, health human resource planning. I think COVID-19, this pandemic has provided us with a great opportunity to really rethink how we deliver care and services in our health system. Who can we partner with? What partnerships and alliances need to be strengthened? And what about our new and integrated ways of working that have emerged as we've evolved through COVID? We all need to be thinking about and focusing on building the skills and the knowledge our system needs to respond to the future. Things are changing, and the way we worked pre-COVID is not the way we're going to work in the future. And that requires a lot of intentional thought and planning and engagement with a lot of partners to affect this new system and this new way of working. So from now on, for the months to come, I think, Joanne, we're really going to need to think about how we leverage the successes, the advances, and the learnings that we got from the pandemic, and how those relate to those 4 strategic pillars I mentioned. And I think for an example that most of us can probably relate with is looking at our digital health strategy and team-based care. When we moved into COVID, we started moving a lot of our services from a face-to-face, in-person, in-facility or clinic, wherever you happen to be working, to a more virtual health type environment. And that was more than just the phone. We were using FaceTime, and we were using Zoom, and we were using Duo, and there were all these platforms that came forward for us to figure out a way how to provide care and services to our patients, clients, and residents. So not everything is amenable to virtual health. I mean, I think of, for physiotherapists, for example, a large part of your role is that physical hands-on assessments. And how do we do that in a virtual health environment? And I think we need to put a lot of thought into thinking differently about how we work, who else is a partner in our health team, and what supports can they be providing to us in a virtual health world, recognizing that our virtual health world today is not our virtual health world for tomorrow, and not everything is amenable to virtual care. We need to think about as well some of the new models we want to be creating around our private and our public sector partners, so that in wave 2, we don't see these shutdowns in key core services that are provided by our private sector colleagues, physiotherapy, speech language pathology. How are we actually working together to continue to enable clients to receive these services? I think thinking about elements like that are going to have considerable longer term positive impacts on our system, but we need to build and strengthen a lot of that out. And our 4 pillars, I think, really align to that, and that's a big part of our work going forward.
Wonderful, thank you. Some good insights around the, as you say, the new way of working over this next while in particular. Anything anyone else would like to add before we move on to the next question? Just looking around the boxes. Okay. I'll move on then to Natasha. So for our second question, what are some of the key aspects of the provincial response to the pandemic that you feel have made a positive impact?
So I think, as Jacqueline said, just that it's really important to think about some of those positives and how do we leverage them moving forward. That's one thing I've been thinking a lot about in terms of the long term, and how do we now keep some of the positive things that have happened sustainable into the future. So when I think about overall some of the positive things we have been able to do over the last 10 weeks, I often think about what are the enablers for us to be able to produce that work. And I would say the first thing was communication. So right away, we all met collectively daily, 30 minutes, touch bases, what's going on, how do we keep those lines of communication going such that the council knew what was coming from the ministry, we knew what was happening in the health authorities, and we could keep those lines of communication open. The second thing would be governance. Good governance is really key, and it was really quite remarkable to see the emergency management response system provincially stand up. I personally had never been so intricately involved in that, and it was quite, I think, very good process in terms of the minister and Bonnie Henry meet, then a smaller group meets with all of the CEOs, then every day the COOs are involved, the chief operating officers, and then we would all meet in the ministry in the HEC structure, which is the Health Emergency Command Center, which then met regularly with the EOCs and the health authorities. And I think that enabled all of us as nursing leaders to be present in all of those groups and to ensure that there was a really a nursing lens to a lot of the activities. And I didn't quite realize that that was fairly unique until the International Council of Nurses actually reached out to me and said, you know, it's pretty rare for a chief nurse to be on the command center calls, to be part of the pandemic response. Can you talk about what you guys have, as a group, have done provincially in terms of those pieces? So I thought that was, you know, every once in a while you get caught up and you don't realize that I think we are doing, you know, really positive things and approaching things and having that nursing voice at the table, which is so very important. So those are the two enabling things that then I think allowed us to do some concrete things as well. Some of them were around clinical guidelines, so there were quite a few clinical guideline committees that the CDC would develop, and we were able to distribute our team on all of those guidelines internally. And I know the council, chief nursing and allied professional officers, practice officers also did that. We were also able to address some health gaps that I think before the Nursing Policy Secretariat was in place would have possibly remained gaps. The Emergency Coordinating Center needed somebody to assist, just one example, in the temporary foreign workers that we're now housing in Richmond for 2 weeks during their self-isolation. And I've been working really closely with Lorraine at Coastal around how do we stand that kind of health response up. And again, it was just having that expertise in terms of what's needed, what level of care. Is it daily? Is it weekends? Is it evenings? How are we actually responding such that those workers are healthy and then that they can get out to the farms and you know, prevent an outbreak? So that's just one example, I think, of some concrete positive things that we were able to do. And then also some scope things have come up as well. And I think always we're looking to optimize scope of practice in the province for all of the nursing designations. And I think this is one example where there's more dialogue and discussion about optimizing scope and some of those enablers that for years we've been talking about, that perhaps now is the time to really seize on that and say, this is something in public health and our end to order a COVID swab, for example, or a COVID test, send it off to the lab and be able to respond on the results. I think that that's a great example of something that public health nurses and other nurses, you know, probably should had the scope of practice, but we didn't have the system enablers in place. So those are some of the small things. And then finally, I would just say that like some of the smaller things in terms of what we were able to move forward within that governance structure. And then finally, I would just say that I think that we did what all nurses are really good at. We built relationships. And that's a real key thing to move some of the pieces of work forward that we had in our action plan and that we needed to do in a short turnaround time. We built relationships and solidified those, and that was really helpful. And I'll stop there. I could go on and on, but I'll stop there and back to you, Joanne.
Great. Lots of insights. Thanks, Natasha. Anyone else from the panel like to sort of provide their perspective on some of those positive impacts related to that provincial coordination or response? I'll give you a minute.
We're all hyper conscious of sticking to the time so that there's time for questions at the end.
Okay. All right, let's move into the next question then. Lorraine, we'll start with you. So what key observations have you made throughout the time of the pandemic response? Do you have a story or a reflection you would like to share of something you've experienced or witnessed during this unique time?
Great. Thank you. So yeah, when I was reflecting on this past couple months, partly it just feels like a bit of a whirlwind, and I think a lot of people probably experience that as well. So there's a few things that I guess maybe I'll just call them themes that stand out for me. So number one would be just this theme of wellness and taking care of ourselves and each other. And I know teams and the organizations have put a lot of focus on that in terms of how we take care of our staff, how the teams stay connected, even though they may not be physically together. And that's so critical in this time when there's a lot more maybe stress and uncertainty that people are feeling, both in their professional and their personal lives, perhaps. The second thing are the innovations and the paradigm shifts that we're seeing as well. So like Jacqueline mentioned, we've seen this massive shift in virtual health. That's one example of maybe a paradigm shift where maybe people perhaps before didn't think it was possible to integrate some of those things into their clinical practice, and now they're seeing those opportunities. But like Jacqueline said, now what we're seeing is this, I would say, the next step in terms of the real questioning about the integration into practice and the appropriateness, and really taking it that next step. So we've seen the giant leap forward, and now we're really refining it and making sure it's in the right places at the right time with the right supports. The third thing would be the incredible sense of team that we see emerging across our different sectors. So again, just really supporting each other, and the breaking down of silos across the organizations and within the organization. So different departments that maybe didn't ever worked together before are working together in new ways, and that's really exciting to see. And more recently, what I see in this the phased reopening is this. It's definitely, I would say, more challenging than the initial focus. So when we were 100% focused on COVID, that was really easy in some ways to determine what you were doing. And now it's this new phase of determining we still have our COVID response, and yet we're reopening health services. And I think it's every day it's sort of figuring out this balance and priorities, and it is challenging. And on top of that, a high level of exhaustion for a lot of people as well. So again, taking care of people, making sure people are getting breaks, and getting their vacations in while we have these opportunities too. So I think those are some of my key reflections. The example that I'd like to share, Natasha mentioned it a little bit there in terms of the teams that we stood up for the temporary foreign worker support. It was like a late Friday afternoon, and I just sent out in our daily bulletin that goes out to staff, knowing that we'd have to stand up this team, a really short message saying, anyone out there interested in being redeployed? And do you happen to speak Spanish as well? And thinking, oh my gosh, you know, is anyone going to be interested? Because we know it can be stressful to be redeployed. And then I'm limiting that even further by asking you to be Spanish speaking. And I was blown away by the response that I got from, and it wasn't even nurses that came forward. I had mental health workers and I had physicians just saying, I want to help. And it was what came through so strongly was their values. They wanted to make sure that those individuals were properly cared for when they came into our country. They wanted to ensure that our food supply chain was taken care of for our entire population. So it was just so heartwarming for me to see just the strong values coming through from everyone in our organization, and the willingness to sort of jump into an unknown situation and support, and again, the collaboration across organization and our ministry as well. So that was my example, so I'll end it there.
What a great example too, and just that sense of community of everyone kind of pulling together in the same direction. Incredible. Thank you for sharing that. Does anyone else have a story or some insight or thing that you'd like to share about either cross health authority or within your health authority, a personal experience?
It's Leanne from Providence Healthcare. Just to reinforce what's already been said, but I think it didn't take long for us to see how everyone just pulled together. Within hours of the pandemic being declared, all of our leaders, our corporate areas, just self-organized into this 24/7 support for the front line. And I know that happened across the province. And it was really all about, many of us are nurses or have worked on the healthcare team for many years. And it was just sensing what the need was and just self-organizing into these 24/7 SWAT teams or 24/7 supports that all rolled into our local EOCs, that rolled into regional EOCs and provincial EOCs. And so just another example of how resilient and how the nursing and the healthcare profession just comes together at a moment's notice.
Yeah, I totally agree, Leanne. And I think, just some of the stories we were hearing about how different professions were supporting one another. And in Fraser Health, we had some redeployment that was happening as well. And that's absolutely anxiety provoking. But watching RTs step into some of our junior nurses and our senior nurses even that were going to be working in critical care to say, you know what, I'm right here if you need me. I'm happy to help. And I don't know how often those groups necessarily come together when there's a new person on the unit, but this was just, it was like a big family, a big neighborhood, and it was just so inspiring just to see how everyone was leaning in to help one another. So I absolutely agree. I think that example around the new workers, Lorraine, is fantastic, because I think that was happening everywhere across the province.
And I just want to pick up on what you said too, and thanks to both of you. Leanne, you mentioned too about we have the direct care teams that really, shone, but also all of those other supports. So the leaders and the corporate supports and the ancillary support, like just everyone, right? So, I mean, I know, a lot of our frontline staff are getting acknowledgement, but it does take an entire village to kind of do this kind of work. And I think you both, all of you kind of captured just how rapidly that really came together. So it was just, I think Lorraine, you said it, it really speaks to the values of people that work in healthcare and what's important. Pretty tremendous. I've got tingles. Yeah. All right. So Leanne, I'm going to come back to you. Just in terms of recognizing that we're still in the midst of a pandemic, what are some of your early lessons learned from the response efforts? And if you could, is there something that you would do differently if we had to do this over again? Which, if there is a wave 2, we may need to be thinking about that. So,
yeah. Well, there's many lessons learned, but I wanted to start off with sort of 3 key pieces that really the pandemic really reinforced for me. It's things that I've known throughout my career as a nurse, but it really resonated with me when I thought back about the very beginning. And really, the reason we're here today and that we've done so well in the pandemic, we can't underestimate the people that have lost their lives or the people that have survived from COVID that are still suffering serious illness. But overall, as a country, as a province, we've done remarkably well. And bringing it down to the local level, I really think it takes leadership, teamwork, and courage. And I think we do first have to talk about the courage that our frontline staff had. There was no question that nurses and allied and the entire healthcare team, I'm going to say they rolled up their sleeves, but I also want to say they didn't roll up their sleeves because they were properly donning and doffing their gowns. But as always, just came together right away, despite us not really knowing what was going to happen with this pandemic, where were we going to go? We were seeing terrible stories on CNN, and there was a real fear amongst all of the caregivers. But notwithstanding that, when you walked around the units, even on day 1, the nurses were in the rooms and they were giving the care that we always give to our patients. And it was really nice to see, although I guess I've known throughout my career how society values healthcare, but it is nice to see, and it was nice to see at the time, the level of support from the community at 7 o'clock. And to this day, in my neighborhood, and when I'm late at the hospital, there's still the banging of pots. It's just remarkable. And so I think we have to be reminded how much frontline workers and the whole healthcare team is valued. Teamwork. We couldn't have done it without teamwork. It really is. United we stood. And if it wasn't for that, for all the stories that we've talked about where nurses, social workers, physicians, nursing unit clerks, the housekeeping staff, the dietary staff, everybody. You can't name everybody. Everybody came together and did jobs that they normally wouldn't do and did it without question. And so it was an amazing show of teamwork that we normally do every day, but this was above and beyond. And then the leadership. So the frontline nurses showed the leadership giving patient care in a time when they really didn't know where this pandemic was going to go. It really didn't know how it was going to impact them. And then the leadership of all the managers and the directors and the CNOs and the VPs and right up to the Ministry of Health, trying to do our best to come up with the best practices in order to give the best care. So it really was a remarkable example of people coming together, showing leadership, teamwork, and the courage. I think one of the early lessons was we couldn't communicate enough. I mean, the message was changing literally hour by hour. You kind of forget about it now because it's, you know, about a month ago or 2 months ago, but honestly, no sooner would we go live with a message, whether it was on PPE or family visiting policies or you name it, suddenly by the time we were announcing the message, it was changing. And so although, you know, we do our best to communicate, we couldn't communicate enough and we couldn't communicate fast enough. But having said that, the other piece that was maybe a silver lining was the ability to course correct and be nimble and make rapid decisions. We had to do that on sometimes an hour by hour basis, particularly at the beginning. And I just saw great examples of that. Whereas sometimes in healthcare, we're sort of charged with being slow and having lots of bureaucracy in making change. We certainly were making change on the fly, whether it was in Vancouver or Prince George. The changes were happening fast and furious. And those are lessons that I think we have to learn for the future. I think we have to be able to make these changes that are necessary and be nimble. And then some of the things that we've already talked about around the virtual health. I mean, I think if there really was a silver lining, it's really about making better decisions about how we treat our patients. We can't go back to the usual care that we've provided. We've got to come up with innovative ways. I know, you know, where my office is in the hospital, I have a lot of physicians that pass by, and many of them have stopped by to talk about how wonderful virtual health is and talk about, you know, how they never thought twice about bringing somebody from the north down to, say, St. Paul's Hospital in the middle of Vancouver and never actually examined the patient, simply had a conversation for 10 minutes and the patient packed up and drove back to the north. And so just the reality of there is better ways of caring for patients, and we really have to not lose some of the silver linings and some of the things that actually worked well. But we're at a state right now where we're doing very well, but we are still, to Joanne's point, we're still in the pandemic. We still have to be extremely careful. We have to try and do our best to try and keep the social distancing, the hand washing. As a frontline nurse, I guess I knew the importance of infection control and donning and doffing and washing my hands, but something like a pandemic really reinforces all those things that we have to do letter perfect, and so we have to continue with that. I think the hardest thing that I've had to do professionally is around the patients and the visitation. Although it made sense that we prevented visitors from coming into long-term care and coming into our hospitals, and we're still at a point where we're talking about changing the policy, but we haven't. I think that's likely been the hardest for me professionally, and I believe for my colleagues and the frontline nurses. It's been very difficult not to have our families at the bedside. I know I've seen lots of really good examples, and I know throughout the province everyone is doing this, but just to highlight the creativity of using iPads and using other means of trying to bring the family in has just been really admirable. But I think that's the toughest piece, and moving forward, hopefully we can relax that and continue with our proper PPE use and really focus on our hand washing and ensuring that we keep our distances to keep this pandemic at bay.
Well said. Thank you very much for that. Any other comments that anyone would like to add on to that before we move on? I would agree with you, Leanne. I think about what weighed heavy on my heart, and I think it was the patients and you know, having access to family, you know, when you're at your most vulnerable and you're unwell state, and that's all you want is someone, you know, that you're familiar with and you trust to be there with you. So that is tough. So thanks for sharing your insights on that. Okay, Maybe we'll move on to Jacqueline. So just sort of building on that thread around the potential for a second wave, can you tell us what you are doing in your role or as part of the council to prepare for that possibility?
Yeah, no, I think as I mentioned before, I think the time is here now to really unpack what we did and what we saw, what we learned as part of COVID. There's no pandemic has only ever had one wave. There's always been something that follows. So we really need to be intentional in how we prepare and plan for both service continuity as well as supporting our staff to relive all of this again. You know, just commenting on Leanne and Lorraine's comments, this has been a very stressful time. And, you know, when that stress response is activated and consistent for such a long time, we do get worn out. We do feel frazzled. We get into thinking about, you know, what are we responsible for now? What are we responsible to keep doing? As Lorraine was saying, you know, we're making this shift now. You know, we're talking about recovery when it's not really recovery. We're just in a lower plateau. We think about, you know, have we lost control and what power do we have to affect our worlds and what's going on around us? Certainly, I think a lot of us have been hearing from staff that they're worried about coming back to work and they're not feeling safe to go back out into their communities and go back to pubs and restaurants and hairdressers and auto mechanics. And, you know, there's still that concern around what do we do with this virus and what happens to me? I think it's so important as a leader, as the council, that we are really meeting and talking with people and encouraging folks to surface those fears and anxieties that they have and talking about it so that we all have a sense that we're not alone in this and that we will together move our way through it. Being caring and compassionate for both our teams and to ourselves is critical. I know here in Fraser Health, our spiritual health practitioners held a webinar earlier this week called Thriving in the Gap. And it was recorded, but out to all staff and leaders. And it was about supporting people in times of uncertainty and acknowledging and validating those concerns and those questions that we're all thinking about. Our ethics department has been holding weekly webinars for staff and leaders on a variety of different subjects. And next week, funny enough, Leanne, I'm going to be part of the panel where we are talking about the impacts of the family presence or the visiting policies on both staff and on patients and families. It's been a really difficult thing. As Joanne said, you know, the people that you want around, that you trust and that give you comfort are the ones that aren't able to be at your bedside. Again, in Fraser, our senior leadership team continues to hold our weekly Leading Together all staff town halls where we share information and answer questions. And this is going on everywhere. And there are unit leaders who are meeting with their 2 or 3 direct reports, all the way up to our CEOs who are holding, town halls and Skype sessions for thousands of people. So we have to keep talking, we have to keep thinking, we have to keep being there to support each other. On a personal note for me, I think, you know, one of the things that I need to be doing, kind of coming down from now and getting ready for the fall, is just reaffirming my own commitment to incorporating some mindfulness in my day and throughout that work day. And I would encourage you all to be asking yourselves the same thing. What are you doing for you in the beginning, the middle, the end of your day? How are you taking that time to just be present and in the moment, to take a deep breath and just check in with yourself? And in saying that, how are we checking in with others too, right? We're all working from home now, or we're taking shifts where, you know, half our team is in the office and half isn't. So I think that's really important. You know, it's tempting, I think, for all of us to move on now and try to get back to normal. And we've been running full steam ahead for 10 weeks, but we have to have a plan for how we're going to get back into a groove, into a phase that's more manageable, because we can't keep running at this high level of productivity and thinking and doing and being. We need to take that step back, to take a deep breath, because as we start thinking about our system level processes, debriefing, all of what we learned and what we need to be doing going forward, the other piece is thinking about those impacts of decisions and those provincial directives that we've had on our patients. thinking about continuing with the interventions and approaches that we were able to put into place or stand up really quickly in the face of many of these system barriers. And not only ask ourselves when things didn't work out, why didn't it work out? What would we do differently? But I think as a CNO and as, whether you've got a formal leadership title or not, I think all of us need to be thinking about all the things that went really well. Why did that happen? And is it something that we can look to sustain and spread? Or was it a function of what was happening in the moment? And if that's the case, how do we unpack that and look at it so that we can structure it to be ready for the future and the way we're going to be working in the future? So I think, all of those, we're all going to be looking to try to do something differently. We're going to be trying to do something better. I think tapping into all the voices of the people around us is really important. Certainly, I'm bright, but I'm not the brightest bulb on the bush. And I really look to all of you and to all of my colleagues across the province and within my own health authority to help give feedback around how do we make things better for our staff and how do we make things better for our patients and our families and our communities. And to do that, for many of us, I think it's, as Lorraine was mentioning, we need to take a little time for us, take a little time to rest. I don't think we've done a lot of that for many of us. And that is the one thing I think we need to do better, is take care of ourselves. So I'll kind of jump off my preaching at that point, Joanne, and kind of turn it over to you. But, I think that's, a few of the things that I think that as leaders, we need to be really encouraging, promoting, and moving forward.
Great. I really like that, and I think it's a good reflective insight around, it's so easy to focus on kind of what's ahead of you or what you need to do, as opposed to kind of that self-care piece. And I think one of the panelists the last time said, we can't, that's why on airplanes, they say to put the mask on yourself first, right? You can't really take care of other things until you kind of do that piece. So. Thank you for reminding us, because I think we need that reminder once in a while.
Well, that's who we are in the system, right? Like all of us, we care for everybody else.
That's right, yeah. And I also liked what you said about sort of the sustaining and spreading. So thinking about what worked well, and then how do we sustain and spread that and grow that, and think about kind of future focus, instead of maybe going back to some of the old ways of trying to do things, right? So. Good insights. Thank you. So I'm just going to check in, Ebolia. I see you are there, but I'm wondering if we can hear you.
Can you hear me?
Wonderful. Yes. Okay. So I'm going to come and pick on you then. I'm so glad we've got you working well. Okay. So Ebolia, I wanted to ask you, what have you been thankful for during the efforts in the pandemic response?
Oh, what a great question. I have so much to be thankful for. Starting right now with technology. It's working. But it's really hard. It sounded like an easy question, but it's actually not easy to answer. There is a lot to be thankful for. And I'm just inspired by seeing my colleagues, the healthcare providers, support services, everyone pulling together, demonstrating such a high level of professionalism, dedication, sacrifice, innovation. And when we go through a crisis, there are two types of responses typically. People either pull away, try to regroup for their own small groups, or people pull together. And this is what I noticed. Although we've been pulled apart, paradoxically, we came closer than before. And we reduced in record time all of those distances that existed in our facilities between our departments. And I'm thankful for that, and I think our patients are thankful too. Many on this call, and I've heard this, and I'm sure people online as well, have contributed punishing hours to the cause. And we made sure that our hospitals, our long-term care homes, our community services are all ready for our expertise, for our care. And all this while we try to keep ourselves, our community safe. And that's not a small thing to do. I know colleagues who have embraced graciously working from home, juggling many responsibilities related to their job, their family lives, and they've done it with, as I said, with a lot of grace and tenacity, and it's not easy. Echoing back to what's been shared already, I think it's so important to emphasize the provincial leadership has been solid. We received consistent messages, and we were able to guide our regional, our local work based on those messages. And I've seen an exceptional level of collaboration, of cooperation between leaders, between point of care staff, at every, as I said, at every level. People came with so much goodwill, tried to help. Leanne, you mentioned that sometimes it takes a big event for us to be speedy and expeditious when we try to create procedures and resources. And we've seen that. We've seen it happen. So I'm very thankful for everything that was produced to assist us at the point of care. And I'm hoping we will see some form of this innovation in our work. And we mentioned digital health, and I'm sure it's here to stay. I'm also thankful for being able to work as part of a team, because by ourselves, not a single profession could have handled such a big situation. And what I've seen is that across professions, people share generously and without reservation information and expertise. I know in our team, we've learned about the valuable contribution of the physiotherapist when it comes to the positioning of the ventilated patient. And I'm grateful for this, especially living in the north, where we don't have so many departments and such specialized expertise. Personally, small things I've learned to appreciate, and thank you, Jacqueline, for reminding us to look after ourselves. I'm very grateful to live in the vast and beautiful British Columbia, and I'm saying that from my heart, because I wasn't born here, and not everyone has been so fortunate as us in British Columbia to bend the curve towards a gradual reopening. And I'm thankful that we can go out for walks in nature and that we've all been safe. And as I say that, there are lots to be thankful for, but I do keep in mind that the work is not done. And the stories that we've heard from our patients, the memories that have been shared about people who have been affected or died of COVID really stay with us and compel us to continue to do the good work that we've done so far. And again, if past experience is any predictor of future behavior, I'm reassured that we will have the capacity to respond to the challenges that come. And I invite all of us to respond with compassion and patience, you know, again, keeping that mindset of innovation and our highest level of professionalism.
Thank you so much. Beautifully said. Much appreciated. I love your thoughts too about just, even though we are pulled apart, as you said, just still feeling that close connection to one another through the work, but also living through the experiences we're sharing. So thanks for that. Any other comments around that anyone wanted to jump in with?
I was just thinking about something that Dawn Medzalski, the Chief Nursing Officer at Island Health, who's retiring today, what she told us last month or 8 weeks ago, when she said, you know, we have to really be appreciative and forgiving for all of the decisions that were made based on the information people had at the time. And I think, Abolia, the way you were sharing some of your thoughts and what you're thankful for, we may not always have been thankful for some of the decisions that were made, but I think people did the best they could in the information that they had and the time that they had. And I think just recognizing that we were all trying to come from the same place and really putting it back to how are we supporting our patients and our families and our staff to continue to deliver great care. So thanks for reminding me about that.
Great, thanks, Jacqueline.
Maybe
right. And I'm watching our time, so we've got a few more minutes left, but I just wanted to kind of circle back with all of you. just around sort of what kind of successful actions have you noted during everyone's efforts in the pandemic response? So, leadership in stressful times, their resilience, working in innovative ways, and collaboration. And I know you've shared some of those examples today. Is there anything else that you would like to share around your observations?
Joanne, so the one thing I would say that I've been reflecting on when you think about leadership and what this very stressful time did is, that I think is a good thing, is you saw a lot more vulnerability in leadership. And I think that we know that vulnerability can create trust and can create relationships. So you heard a lot more like, the message may change in 4 hours, but I can't control that. We apologize in advance. This messaging still isn't out, and we recognize it needs to be out, but it's not within my control to do X, Y, and Z. And I just really appreciated that. And I often think that as a system, we could use more of that. And it was nice to kind of see that opened up a bit. And I'm quite hopeful that we can continue with that, because I just think it's so important to our relationships, and being successful at, collectively having a shared purpose, shared meaning, and how we all are after, improving the quality of British Columbians in a meaningful way, through amazing nursing care. So, how do we kind of stay on that and build those relationships to achieve that? So that was just one thing that I've been thinking about lately as a leader, and seeing other mentors and leaders that I'm surrounded by in terms of the vulnerability piece and how important it is.
I think
Go ahead, Lorraine.
the piece that I'll add too is just the emergency operations structure, both at the health authority level and provincially. I had never seen anything quite like that. And the documentation and the amount of work that was done up front, and a lot of those efforts have never seen the light of day because we didn't need them, because we never were on that curve. But that work is now there. So whether it's the surge planning, the redeployment plans, the education plans, so that is work and assets that we all own collectively, and that will support us, whether it's in a second wave, another pandemic, another disaster, whether it's an earthquake. So that work will not be lost, and that's hugely impactful for all of us and for the province as well. So we can pull those things out again, we can adapt them, learn what worked, didn't work, or tweak them, but that shouldn't be underestimated in impact moving forward as well, even though a lot of it was never seen because we didn't need to bring it forward.
That's a good point, Lorraine, and I think we also have to mention as well, we are actually well prepared for the second wave and or another pandemic in the future, and we have those plans in place. But we also have to keep remembering around the resilience. There's still many outbreaks in long-term care. There's still outbreaks in other areas, and so there's still many staff that are really head down in the pandemic. So we have to balance the need for rest, and we do need to catch our breath over the next couple of months in case or when the next wave hits us. So we have to be mindful of that. We have to be mindful of all the patients that got canceled on the wait list, and how do we try in a safe and supportive way getting those patients in for their surgeries and their diagnostic testing. And then we also have to continue to support the staff that are still out there and are well immersed still in outbreaks. And so it really is a big balancing act right now, and trying to stay strong and supportive throughout.
I totally agree, Leanne. Absolutely. And I'm going to squint here for a minute because I just saw something come in the chat box from Carolyn Solomon, who was asking just around everything that we've established. Do we get a sense if there's an opportunity to really strengthen provincial responses going forward, the policies that we've done, the innovations and the approaches? And, you know, I would say absolutely. I think of some of the work that we've done for Fraser Health around corrections and the outbreaks that were in corrections facilities. And, you know, that level of response that was provided provincially to support the provincial corrections has gone off into federal. So I think we are really being a leader in a lot of work that's happening here in BC. And I know, I mean, I don't know how many times we were, you know, in texts and emails back and forth saying, hey, do you guys have a policy around this? Or what are we doing around that? And there wasn't any of that. This is my health authority, put the stamp on it. It was really about, absolutely, I've got this, here you go. And I think there are a lot of policies that if Fiona Carmeli, who is CNO at PHSA, if she was here, she would be saying, you know, there's a lot of work that we're going to be doing provincially to look at all of these policies. And Fraser and Vancouver Coastal and PHC do not have to all have their same code blue or a different code blue policy. This is how we need to really move it forward. And I think, Carolyn, this pandemic really spurred us to recognize that there's a lot of things we do similarly. And a lot of evidence-based practice can be put into place because patients should get the same kind of care no matter where they show up. So I think this will make us do a lot of what you're asking about. Are we there yet? No, but I think we will absolutely be strengthening more provincial responses as a result of this. And great question, thank you.
Thanks for that. And I'll just follow up. There was also another comment from Andrew Saunderson around advanced care planning and just how, you know, something like this really highlights the need and importance of that work. And, you know, is that something kind of going forward that we need to take another look at in the province? I'm seeing nods around the screen. So yes, absolutely. Well, we are at time, and I know there were a few other questions or comments in the chat box we didn't get to. We will take a look at those afterwards and try to follow up. As I mentioned, though, that the session's recorded, we will be sharing that out over the next week or so, and hopefully maybe capture some of the salient points that all of you shared as well and share that back out to participants and those that weren't able to join us. But I just want to say a huge thank you to all of you for being on the panel and for being vulnerable to share yourselves in a new virtual way, but just to indulge us with the questions that are on people's minds. So just want to say thank you very much to the panel, but to all of you out there listening and participating today, a huge thank you to you as well for being interested and engaged in this sort of panel forum. So thank you very much, and maybe we'll look forward to doing some more of these in the future as well. Have a great afternoon, and I'm just going to go back, Jacqueline, to what you said. You know, I'm going to leave you with what are you doing to take care of yourself over this weekend. So enjoy, and talk to you all next week.